Ladies and gentlemen, welcome to the Authentic Podcast with Justin Doulard. And thank you for tuning in to another episode. And now, this is the moment you've all been waiting for. Another genuine conversation with a unique individual. It's time!
Okay, everybody, welcome back to the Authentic Podcast. We're going to be doing episode number 15. Happy Thanksgiving. Hope everyone's having a good holiday and a break. Got my dad here with me today, who we will be addressing as Mr. Brian Hale. Brian has worked in healthcare for a little over 25 years. And I'm going to give him a little introduction and then kind of let him talk about himself. So, started out as a nurse and, eventually worked his way up into healthcare admin. So, Dad, a.k.a. Brian, tell us a little bit about that.
So I started off as a registered nurse working in an intensive care unit, then level 1 trauma center, and then became an emergency medical technician so that I could start working on the helicopter, and did that for 14 years up until 2017, which is really kind of when I stopped practicing as a nurse, at least on a part-time basis. And I've been working as a healthcare administrator since 2004. Went on and got an MBA from Northeastern State University there in Tahlequah because that seemed to be something that would kind of help support what I was doing in administration.
I think we will state this several times, but you can reiterate if you want. You're obviously not a doctor.
Correct.
You don't work for the CDC.
Correct. I think that's a good place to say, like, none of what I say should be construed as medical advice. This isn't establishing a relationship as a patient or anything like that. And anything that I say doesn't reflect on my current employer, which would be Cherokee Nation Health Services.
Good deal. Wanted to do that. And obviously very few people are an expert on the coronavirus, which is what we're going to talk about. I know you're probably maxed out on talking about it, working 12 to 14 hours a day for I don't know how many months.
Since early March. And really, I started paying attention to this in late January.
I do know that.
We started, if you recall, even when we went to Whistler for our ski trip.
I do.
There was some discussion then. And one of the things that's kind of interesting is we had started seeing videos that were coming out of China that were allegedly people passing out from this new disease that nobody knew about. People were just falling down on the street, and these ambulances would pull up and snatch them off the street and just run away with them. And then they started showing videos with people welding doors shut on apartment buildings. And so at that point, I asked your sister, Braylon, I said, what are they really saying in these videos? Because I didn't believe it. And then she translated it from Mandarin and said, oh, they're locking all these people in the building because they're sick. And that's when I was like, I want to start making sure we're paying attention to this. And so I started asking our infectious disease people, what do you know about this virus coming out of Wuhan? And that's when we kind of started, paying attention to it. And then I kind of started, doing some things to make sure we were doing what we could to maybe be ready in case it became a real issue.
Didn't you give Braylon major credit to your alertness?
I did, absolutely, because
that?
We had those videos that were coming out, and you couldn't really trust what they were saying because you had people explaining what they were saying, but I wanted someone who really knew Chinese, to tell me what they were saying. And when she, confirmed that that's what was going on in those videos, that's when I was like, okay, we need to be ready for this.
I'm going to have lots of questions, some from me and then some from people I told to chime in and ask. And then, for the umpteenth time, going to say, if you don't know the answer, you can say, I don't know. Or if you say, I think this is it, or I don't know, don't feel afraid to, or don't be afraid to say you're not sure. This is what we think. But I've heard so many different things, just like everyone else on the internet. Where did coronavirus originate from? I've heard all kinds of stuff. So,
One way or the other,
and when?
to the best of our knowledge, one way or another, it started somewhere in China. But I should say a lot of viruses jump and kind of start in Asia, specifically in China.
And I have to ask this. I think I know the answer, but is the bat story bullshit?
No, I don't think it's bullshit. I think this was definitely a virus that, at one point in time only affected bats. And, most of the time viruses kind of stay in a species, right? But when they jump from one species to another, that's when you have a problem. So like when you've heard about avian influenza, swine influenza, these are viruses that predominantly are in birds or pigs, and then they'll jump, for whatever reason, because you have what they call genetic drift. As viruses replicate themselves, it's like making a copy of a copy of a copy. And so you get changes, slight changes, and for whatever reason, one virus may take off, one variant of that virus may take off and become prevalent, and you then have a pandemic like we have right now. And this is not new. This is just the biggest one we've had in my lifetime, certainly the biggest one in your lifetime, but this is not the first pandemic, and it won't be the last.
So we know what 2020 has held and what happened there. Give me some predictions for 2021. I mean, anything, like when the vaccine will be ready, will it be effective? When will we stop wearing masks?
I think it's going to be a while before we stop wearing masks. And that's a good question because...
And these are just predictions.
Right. So we're going to have a vaccine, it looks like. They're going for emergency use authorization in early December. And so if the FDA, they have a group of people... They have a group of people that'll evaluate all the data. Is this vaccine safe? Does this vaccine work? And that's the first vaccine from Pfizer. The second one in the pipeline is one from Moderna. Both of them are brand new platforms for a vaccine. They're called messenger RNA vaccines. And so that's one of the reasons that they can get these produced so quickly is because just the production process for that kind of vaccine lets you go a little faster than some of the more traditional methods. But because of Operation Warp Speed, which is this collaboration between private industry, the government, and the Department of Defense, their goal has been to have 300 million doses of a vaccine by January of 2021. They're making the vaccine now and hoping that it's approved, hoping that it works. They've even had to develop special vials for the vaccine because the first vaccine, the Pfizer vaccine, has to be kept at minus 80 Celsius. And glass doesn't do well when it's that cold. So they've had to come up with new processes for making glass vials that don't crack, that don't flake and become a safety hazard. So I think by spring of 2021, we'll have fairly widespread availability of the first two vaccines from Pfizer and Moderna. Now, a vaccine is not going to be a silver bullet for COVID. This is going to be another layer of defense that we have to incorporate. So I think we're still going to need to have masks. We're still going to need to have social distancing, hand hygiene, all these things that we've been doing, avoiding large gatherings, all that combined with the vaccine. And there's also a lot we don't know about the vaccine yet. How long does this immune protection last? Nobody really knows that yet.
Are there anything that you can think of that when we started out, this is what we thought, and we've learned that it isn't necessary, or it was bogus, or anything of that matter, I guess? Like, so for example, people had said that the virus could stay on hardwood surfaces, so it was like disinfect everything, and then I've heard that it's only airborne.
That doesn't seem to be as much of a transmission factor as people thought initially.
Okay.
And I also think that a lot of that goes back to giving people a sense that there's something they can do.
Okay.
When you talk about like the toilet paper shortage initially, well, no one's going to use more toilet paper or anything like that, but I think it's one of those things that people can lock onto, and it feels like they're doing something. People want to have control. People want to feel like they're doing something to prepare.
And I guess it never hurts to clean your house a little more during
Correct.
Flu season. So when do you think that we will be without a mask? It does not bother me to wear one. I'm just simply curious. Is sometime in 2021?
I'm hoping by summer of 2021, things will be approaching normal. I think full normalcy is going to be a few years.
What about?
And a lot of this also depends on what this virus does. We've had viruses before, going back to the 1918 Spanish flu, that, what they call, the Great Spanish Flu. That one, for whatever reason, it lasted, 2.5 years and just kind of disappeared.
How much do you compare stats from state to state? Because I know your focus is northeastern Oklahoma primarily. How much do you guys look at other states' data compared to Oklahoma, Texas, the surrounding areas?
A lot, just because, we have states that border us, and so we pay attention there. And you also want to watch states to see what worked, look at, states that have been, really aggressive with managing or trying to manage COVID and seeing, what worked and what didn't work. And, what it looks like now is that, to some extent, everyone's efforts, despite some of the draconian measures some of the states have taken, especially you think about, New York and California, and now they're back in a surge just like everybody else.
So based on your opinion, looking at the data, what states have been the worst and what states have been the best? Or is there a state individually or an area?
Vermont stands out. Vermont is a state that has done really well with it.
Interesting. And what about the worst?
You think about Florida. For whatever reason, it's always Florida. You think about, Texas. South Dakota is really having a rough time with it right now.
We watched that. Well, we watched on YouTube, listened to it, that podcast earlier, and you being Colton, I don't know if you heard it or not, but he was talking about, which is what a lot of people have said. You said it, Mom has said it. A lot of my friends say, specifically Oklahoma, but the South, sometimes you go through there and you can't tell anything is going on. And that's what Johnny Manziel said on his podcast. He said, I've traveled a lot during the COVID season, and he said, the South is different. He said, they just don't care.
Right. Yeah,
Why?
You can't tell anything's happened. Well, I think initially the South and the Midwest were spared, right? Initially when this all started, everybody locked down, everybody, did everything they were supposed to do. And really it was only hitting New York City and, maybe Washington State and Oregon and places like that. And it just didn't get us. And so I think that kind of led to, some alarm fatigue, people getting tired of hearing about it. We weren't seeing it. We weren't seeing stacks of bodies like you saw in New York City. And so I think that, people kind of, realize that there's this huge economic impact to all these lockdown measures. And also, we don't have the population density like a lot of those places do. And so I think it kind of bought us some time. We had this gift of distance and time. And, hopefully people took that gift and made the most of it to get ready, make sure the healthcare systems, had some resiliency that, and we also learned a lot. I think one of the reasons the mortality rate has decreased the way that it has is we're better at taking care of people that have it. We know now that mechanical ventilation, putting people on a ventilator, is not the best strategy for most people.
I had a nurse friend share on Facebook the other day that there was 0 beds in the ICU in Northeast Oklahoma and Northwest Arkansas. Is this true?
That is true. And I will say that, the bed situation has been bad. But, the other thing is it's bad every winter because of flu season. And there are not enough beds. And, you have a healthcare system that has these incentives to do everything you can to cut costs. And inpatient beds, especially ICU beds, critical care beds, they're expensive. They're expensive to maintain. And so hospitals, up until now, they've really not had a great reason to keep more beds than what they absolutely need. And so you have people with the MBAs, with, kind of the bean counters, doing everything they can to reduce expenses. And so there's not enough ICU beds for when you have something like this happen. There's not, and it's not just the beds, it's people. You've got to have respiratory therapists. You've got to have nurses. You've got to have physicians who know how to manage someone who's critically ill. And then the other thing that I think a lot of people forget about is you've got to have housekeepers. You've got to have lab. You've got to have radiology. You've got to have, security. You've got to have this entire group of people. You've got to have the HVAC guy who keeps the air conditioning going, the plumbers that keep things running. And so it's not just nurses, it's not just doctors, it's everybody on that team that makes a hospital work. And in a lot of places, it's been cut to the bone. One of the reasons that we didn't have enough PPE is, like so many businesses, we adopted a just-in-time inventory strategy so that, the truck comes twice a week delivering supplies. So just like grocery stores, there's not a big warehouse in the back, with stacks and pallets of groceries. There's not pallets of PPE waiting for a big event like this. Everyone assumed that the supply chain would keep working.
Well, I guess good news on that fact, if you want to talk about it a little bit, you want to hit on the PPE facility that's coming in?
Yes.
Is that going to be done in time to have a big enough impact on COVID, or is that something that's going to be better for future issues?
I think a little bit of both.
Okay.
I think that, what we're seeing is that, this may not be the final surge. The vaccine may not be the end-all, be-all. We still don't know a lot about the vaccine yet. No one's ever approved a vaccine this quickly before. And I think that's a credit to the scientists, the researchers, the physicians, and everybody that did all that work. But we don't know a lot about it yet. So I think there's always going to be a need for more PPE. They're already tracking an influenza virus that may be a problem, coming up in the next season. And so I think that, there has been very little in the way of PPE manufacturing ability domestically in the United States. And one of the things that I've told people is we'd never let China make our aircraft carriers. We'd never let China make our nuclear submarines. Why are we letting these other places, third world countries for the most part, make our protective equipment, make all of our medications? There have been supply chain disruptions for a long time because so many medications are made in India and places like that. And this is not anything against those countries, but if you look at kind of their industrial accident rate, these are not countries that have processes wired tight for medications and pharmaceuticals. Most U.S. Supplies of saline bags come from Puerto Rico. And so every time a hurricane hits Puerto Rico, there's a disruption to the supply of IV bags. We're talking about salt water. This is not something that there should ever be a shortage of. But, when you have one factory producing something in the world, you've got a vulnerability there. And so I think that the idea of bringing back domestic production of these important items, these important medications, is critical for our national security. And I think we see that now. And so I think that some of the steps that were taken to, start making PPE locally is going to be a big help. I think about the Berry Amendment, right? The Berry Amendment is this national law that says anything that touches U.S. soldiers, sailor, airmen has to be made domestically. And that's to make sure that there's always going to be a domestic source of uniforms, boots, belts, all the things that you need to fight a war. I think we need a Berry Amendment for healthcare supplies.
And that facility you guys are building is a good start to that.
I think it's a great start.
At least for the region. So
this stuff is simple to make.
Yeah.
You're talking about paper.
Well, I know, how much it costs and then how much it costs to make, about like a lot of stuff. But I'm sure you know more than me, but there's still a ton of people who are anti-maskers who do not believe that it works. I still just typically follow good practice guidance. Obviously from you and medical professionals, I generally take, standard advice. I get, you could go on forever. You could argue with someone until you're blue in the face, and this probably won't change it either. But give me like a brief 1 to 2 minute pitch on why a mask works and why the theory that it doesn't work is just bullshit.
Okay. So I think the first thing to know is one of the things that I think has really caused the CDC a lot of credibility issues, in the federal government a lot of credibility issue is initially in the beginning of the response, there were not enough surgical masks, there were not enough N95s to go around.
So they said don't take them, right?
So, and Fauci has said this in an interview, right? Dr. Fauci, that initially they gave this guidance because they didn't want to create a run on masks. They wanted there to be enough masks for the people at high risk.
Like the toilet paper we had.
Exactly. And so they had this initial guidance that says, hey, you don't need a mask. And if you remember some of the text messages I would send you is like, go to the hardware store and get some masks. And this was, in the very beginning of this. Because if this is a, coronavirus, you kind of know how it's spread, right? I mean, it's the same virus that causes the common cold and things like that. And so I think that really caused a lot of problems early on, as you had this, I would say poor messaging. So, when you think about the size of a virus, right, and it's tiny, it's measured in like microns, right? And people have a hard time, I think, understanding how a mask can stop that. Well, the virus typically is riding. Okay, it's not like by itself. It's typically, when you talk about the virus coming out of a person, it's coming out in a droplet because they're coughing, they're sneezing, singing, talking, laughing, whatever. So the mask stops the droplet and therefore stops the virus. The other thing is, if you have a blown polypropylene mask, a mask like, a surgical mask, an N95, it also has, it stops some of these viruses because of the static charge in the mask. That's why a surgical mask is only good for a certain amount of time, because it loses that static charge. When it gets wet, it loses that static charge. And so, there's a lot of ways that the viruses, are stopped by the mask, both mechanically, chemically, and things like that. And the masks, really only help if everybody's wearing them. You want to contain the virus in the people that are sick, and you want to also block the virus from the people that are well. And so that's why you need everybody wearing a mask in order for it to be, the most effective. And the other thing I would say is, let's say masks are total bullshit. What does it hurt to wear one right now?
I've never understood that.
That's when you talk about, respecting your elders, when you talk about taking care of the most vulnerable among us, just bite the bullet.
No, I say the same things over and over and over, and I've said this a dozen times to everyone. Typically if you tell me something, I follow it, and then you wear your mask, and I wear the mask, and it's not a big deal. But I always tell people, if you told me to wear full PPE and a gas mask to the grocery store, I'd be like, okay, I'll do it, Dad. And then I probably wouldn't.
But you look in your bag and it's all there.
Just in case. But yeah, I say that all the time. I don't understand the mask thing either. I'm sure a lot of people do, and everybody has their reasons. They think they're...
America is different, right?
I think we're too free sometimes.
And you think about, firearms, you think about cars, you think about all the things that really most other countries, they don't feel the same way that America does about them. And I think masks are the same way. I mean, we're a freedom-loving people. We don't like being told what to do by the government, with good reason. Yeah. But I think this is one of those things where that's hurting us.
It's biting us in the ass.
It is. And so I think if we want our economy to keep going, if we want to keep, people working, if we want to keep progressing forward, everybody needs to do everything that we, at least as of today, what we know to be helpful.
On kind of a different economic note, for the small business owners or the businesses in general, you think the best way to keep them, one, safe, and then two, keep them in business without shutting down is the limited capacity and the distancing and the masks, when you can and whatnot?
Yeah, limiting the capacity, doing everything that you can to keep people, at least separated from one another, a little bit, having good ventilation, making sure that people are wearing masks when they come into a business, and I think about restaurants, we've done just takeout, DoorDash, things like that, just trying to, continue patronizing businesses, restaurants and things like that, and keeping them afloat because, the U.S. really, a lot of people earn their living, in the service industry. And that's what's really been ravaged by this. And there's an economic impact to shutting all that down. And I think at some point you almost go past you could have, more lives lost because of the economic impact of shutdowns than what you would have with the coronavirus. Now, I don't know where that point is, but there is definitely, there's a documented economic toll of unemployment.
Yeah.
And then you think about all the people that are not getting colonoscopies, that are not getting mammograms, all these, cancers that are not being screened for because of people are afraid to go to the hospital.
Right. Unless it's an emergency. Did you want to hit on the Bushwhack deal?
Yeah. So when you talk about a business that's done what they can to keep their people safe, I think about the Pack Rat Outdoor Center. And they really very early on, implemented some measures to to keep their people safe. And
Is that Fayetteville?
that's Pack Rat in Fayetteville. That's the outdoor facility that sponsors the Bruja Bushwhack that I've been trying to get you to come and do with us. And so I think that, they listened, I think to their credit, they listened to some people like Dr. Montgomery, who's our chief medical officer. And, they limited access to the stores and really focused on, hey, if you know what you want, tell us, we'll bring it out to you, And of course, obviously a lot of, a big push on the online sales and things like that. But they did a lot of things to limit access to the store safely.
I did, as we mentioned earlier, I did ask for people to submit questions. So I do want to hit on those if you don't mind. Some of them are pretty in depth, and then some of them, are, I guess, kind of situational. So once again, if it's something you don't think you can, fully answer without having more details, then let me know. But there are quite a few, and I'm gonna give them a rundown if you don't mind. Okay. So my buddy Brian, if you test positive and you quarantine for 2 weeks, then you get retested and you are still positive, do you have to quarantine for 2 more weeks?
Probably not, but it depends on the kind of test. And so there are basically, and I'm going to talk in broad brushstrokes here, there's basically 3 kinds of tests. Okay. There's the PCR test, the polymerase chain reaction test, which is probably one of the more sensitive tests. And that is the one where if you test positive, there's no value in you undergoing that test again for 90 days, because that is a very sensitive test that is going to pick up pieces that are going to show positive, but it doesn't mean that you have the virus actively in you and that you're infected or contagious. So once you're positive, once you're sick with COVID, your PCR test is going to be positive for quite a while, potentially.
A PCR test is given how?
The PCR test is the nasal swab.
Okay.
And that's the swab where, at least initially, it had to go like way back, like touch the back of your nose.
I've had one, and that's the one I had.
Yeah. And then the other test is the antigen test. And that's the one that has a lot of value in it, and the one that is becoming very widespread thanks to, there's the one that I'm pretty familiar with is the Abbott Binax Now test. And what's really helpful about that is it typically only shows a positive if you're actively infected and contagious. And then the other test is the antibody test. And you could have, antibodies, for, months after you're infected. So,
okay.
So it's possible that it's probable you're going to have a positive PCR test for a long time after you're sick.
So the answer to that, quarantine for 2 more weeks, is just situational?
It's going to be situational. You need to talk with, the case investigators, the contact tracers, basically your state epi office.
Okay.
That's why there's no value in testing again on a PCR for someone who's had it.
Okay. This one's a funny one, which we kind of addressed, but my buddy said, ask them what the F is going on in a professional way. So I think that's just where we're at and what we're doing. So that was just kind of a funny one. But
so what's going on is we have a virus that we've never dealt with before. Okay. And we've dealt with coronaviruses for a long time. One of the ideas behind the reason that some people seem to get sicker with it than others is that because most of us have been exposed to a form of a coronavirus in the past, right? You've almost all of us have had a cold. Your T cells, which is one of your body's defenses that's responsible for remembering all the viruses and germs that you've been exposed to and being ready to mount that defense. Some people may have a T cell that is helping with that old coronavirus response, right? But we have this new virus. And do you know why they call it a coronavirus?
I do, because if you told me this
Okay.
morning, but I want to hear
I think it would be helpful. They call it a novel coronavirus. It's novel because it's brand new to humans, right? We've never seen this. This is a new coronavirus to us. They call it a coronavirus. I want you to think about a bottle of Corona beer. It's got a crown on it. Corona is Latin for crown. And the reason a coronavirus is called a coronavirus is that when you look at it under like an electron microscope, it has these spike proteins that stick out from the cell, and it looks like a crown. That spike protein is how it busts into your healthy cells and starts making copies of itself. A virus can't reproduce on its own. It has to have your cell to make more of itself. And so just like every living being, its drive is to make more of itself. And so it does that by taking over your cells.
Very good. Thank you. So this is the start of Steven's questions. He has quite a few. I do know he's a school teacher. So once again, if they're a little too complex, we can break it down or try. But schools can't stay open because they get one positive case in the classroom and the entire class typically needs to quarantine. How effective are the desk shields, pod groups with social distancing between groups, in addition to masks inside the classroom as far as containing the virus? With all these precautions in place, how likely is it the virus will spread to others in the classroom / outside the group?
I want to talk about New York City. New York City has a rule that if they have a test positivity rate above 3%, they close the schools. Well,
that's 3% of
3%. So the way you calculate the test positivity rate is you take your denominator, right? The number of tests that you perform, right? But you take the number of positive tests divided by the number of tests that you perform, and that's your test positivity rate. 3% is pretty low right now during the middle of a pandemic. You're going to trip 3%. There's just no way around it. And the other thing is, are you talking about 3% of the students testing positive? The other thing is, at least so far, kids don't seem to be affected as much by this. They can spread it, but they don't seem to be, impacted by it. And then if you think about all the social implications of kids not being in school, it's not good. And that's probably one of those things where the harm is outweighing the benefit. My personal opinion is, we need to do everything that we can to safely keep kids in school. And we talked about layers of defense, right? There's no one thing. If you think about it, think about Swiss cheese, slices of Swiss cheese. If you hold up one piece of Swiss cheese, you can look through it pretty easy. If you put up another second piece of Swiss cheese, right, it's a little harder to look through it. Every additional layer of defense makes it harder for the coronavirus to get to you. And so, the barriers, the separation, the pods and things like that, all of those things help make school a little bit safer. That's also where the antigen testing can really come in handy. Doing everything that you can to test those kids periodically. And you're not aiming to keep it out of the school. You can't keep COVID out, but you can prevent outbreaks in the school.
Gotcha. That's a good answer. We kind of touched on this one earlier, but I'll go ahead and ask it just in case. But I've heard scientists no longer believe you can contract the virus from touching contaminated surfaces and then touching a mucous membrane. Why do we still disinfect everything for COVID? At school, they want us to disinfect playground equipment after each class use, in addition to the desks and other high-touch surfaces. This is a precaution, but is it even effective as the virus isn't believed to even transfer that way anymore? And that's, I think, what you mentioned is kind of the empowerment.
So there's other viruses that do transfer like that, and nobody knows everything that we need to know yet about COVID.
It's safe than sorry.
It's better safe than sorry. Now, this is my speculation. The outdoor playground equipment, if it's outside, this virus is killed pretty quickly by UVC or sunlight. And so that's probably a little bit overkill, but at this point, I think people want to feel like they're doing everything they can to keep kids safe. So, I think until we know definitively, what the heck.
If we got the cleaning supplies,
Right.
Might as well. Okay. Are the 2 vaccines that are being released soon both 2 separate doses?
Yes. Both of them require 2 doses.
Can you elaborate on that more? I don't know if I'm smart enough to understand what that means.
So these 2 are both what they call messenger RNA vaccines, and they require 2 doses to generate the antibody response that's necessary to protect you from this disease. So real quickly, the way any vaccine works is it tells your body's defenses what to attack. So if you think about your body as a city, okay, and you think about the virus as a bank robber, and the bank robber is getting on the highway in its car to get away. Think of a vaccine as that police dispatcher that's telling the cops the bad guy is in a red Chevy pickup truck. So you need to go and pull over and get every red Chevy pickup truck. A vaccine is telling your body what to look for. Think of the vaccine as that dispatcher telling the cops, telling your antibodies what to go for. Your body's defenses have never seen this coronavirus before. The vaccine tells them what to look for. With the coronavirus specifically, it's this spike protein that sticks off of it.
I don't know how often you use these layman's terms, but I appreciate it.
Okay.
The bank robber. I need that because beforehand, but that's good. Okay. How fast do they believe they can provide vaccines to the country to actually shut down this virus?
I think by spring of 2021, we'll have pretty widespread availability of the vaccine. They can make 20 million doses a month, right? Problem is with these first two, it takes 2 doses, right? So essentially that's 10 million people predicted a month. So the way they've prioritized this is the first vaccines are going to go to essential personnel. So you're talking about direct care healthcare people. You're talking about firefighters, police officers, utility workers, people that make your water clean to drink, people that can keep the power on. So those are all people that really need to be protected first, along with people that are really high risk, which are going to be people that are over 65 years of age and people that have comorbid conditions that coronavirus seems to target, which is people that are obese, people that have diabetes, people that have respiratory issues already. What I will say is COVID is a really good reminder about why all of us need to take personal responsibility for our health and well-being. If you're already healthy, if you've had your flu shot, if you exercise, if you eat right, if you keep a healthy body weight, you're better prepared to weather COVID and any other disease that comes your way. And so I really think, this disease is almost custom designed to affect America worse than a lot of other places. So
you don't think that we're in shape and we exercise and
I think if you look at the data,
I'm just joking.
Shows that we're, as a whole, we're on the buffet for COVID.
Yeah, I've only traveled overseas once or twice, but when we went to Scotland and Ireland, there was a lot of skinny people. I was one of
If you go to the East and the West Coast, you see, people that are far different than people that you typically see in the Midwest and the South.
Yeah, that's true. After the 2 doses of the vaccine have been given, if someone that's been vaccinated is exposed, are they still able to contract the virus?
They don't know yet. They don't think so.
Okay.
They should not be able to. There is some concern, there is some question that someone could get the vaccine, have the protection, but still be able to carry the virus. And so that is a question that still needs to be answered. If you think about the influenza virus, the influenza vaccination, it generally shuts it down and you're not able to carry it and spread it. So hopefully this will be the same way.
Okay. I think this is the only political one we got. It's pretty soft. So how do we get our governor to mandate masks across the state? He advocates for personal responsibility, and we know people won't take that responsibility seriously. They won't even push shopping carts into a corral.
I don't have a great answer for that. I have been really disappointed with the way that our state has responded. It's almost like they've, and I've been, somewhat involved with some of the calls and things like that. And I know there's some people, that work really hard, but I think that, that kind of leadership at the very top, mandating some of these things, hasn't been maybe what we'd all like to see. But also, I will say that, I think some states have really tried to balance responding to the virus with also keeping people employed. And I think that's important too. And I think, when you think about the Midwest and the South, these are states that typically they're not doing great when times are good. And so
We kind of get by.
yeah, we, if you think about what this has done with, the demand for oil and things like that, and Oklahoma is very much dependent on petroleum. And so when oil prices go down, it hurts us.
I am curious to hear what, sorry, new question. I'm curious to hear what someone would say about the highly contagious virus not spreading to family members in a household. It seems to be highly contagious, but I have known several cases where only one member tested positive in a house, even between the husband and the wife.
My experience is that if someone in the house gets it, they all get it. But now the other thing is, not everybody is symptomatic with it. And I think that kind of goes back to, some of the theories that we've talked about. Either, there is, some sort of variant that is not causing the symptoms, or maybe someone has that, T cell that remembers another coronavirus and mounts a better response. But typically, if someone in a household has it, we see transmission within that house.
Okay. Let's see, looking up this next question. What are the stages of the virus as far as how long after exposure before it has incubated enough to start shedding and make the person contagious?
Usually it's 3 to 5 days. And that's kind of what makes this virus tough, is that, you have this kind of prolonged period between, being exposed and getting sick. And so then that tracing that back to when that person got sick and, where it came from is a problem. And then you also have, where people are infectious and shedding the virus, but don't, they don't know it yet. And so many people have, and, most of the people that I know that have had it, they're not profoundly ill. If you think about Oklahoma and, the allergies, right? Allergy season. Well, who doesn't have a dry, scratchy throat? Who doesn't have a runny nose? Who doesn't have some congestion? And so a lot of people that manifest like that, who knows if it's COVID or not? And so that's why we need more testing, more routine testing, and and just access, to those testing resources that are more widespread.
Good stuff. Okay, we got 2 more questions, and then the first one I think we answered, but I'm gonna go and ask it too, since I told people I would. But my son ate after someone 2 days before they were hospitalized with COVID. She was showing symptoms. We just thought they were her COPD symptoms. We were around her several days while she was showing symptoms. How did my son, at the very least, not get it? Or is it likely he got it and had no symptoms? And then I know you said kids.
Could be A or B.
Okay.
One of the things that COVID attacks is ACE receptors. And kids typically don't have a lot of those yet. And so that's one reason they think that children may be somewhat protected from the virus. And then you also have, this weird variation with COVID where you have people that are infected with it, but they don't show any symptoms of it.
Last one. I want to know if there's really 3 months of immunity. And if so, do you have to have the antibodies?
Nobody knows how long the immunity lasts. 90 days is kind of what they see in the data, but bear in mind, this is a disease we've been dealing with for barely a year in the United States. Really not a year in the United States. This kind of first cropped up in China in November, we think. And then, in the United States, we really didn't start paying attention and gathering data till probably February, March at the best. So there's a lot of data that we don't have for COVID yet.
So I'm laughing, thinking inside my head, because I know you don't have a lot of social media, but there were these memes going around that said all these people were like, basically, like you said, coronavirus kind of got more prevalent in America in the spring or the late winter, but there were all these memes and sayings around. People were saying, I think I had coronavirus in November, and I already passed it because they had all the symptoms, like you said, but. Then there were some people who I think they really thought they had coronavirus way back then. Do you think that's possible, or probably not? Or is that just a meme?
Probably not. I do know that I've read some articles where they have done some research on some people in LA on the West Coast, and they actually found samples of coronavirus earlier than anyone thought. And if you think about, kind of travel patterns from Asia, that kind of makes sense that, you might have exposure there earlier than other places in the United States. So I think it's possible if this, was kind of, banging around maybe before anybody really knew about it. And the other thing is we talked about that genetic drift with viruses, and so it's possible that some version of it was running around before anyone really recognized it, and then it changed, it evolved on its own, and is what we see now.
So I've been very fortunate and have been relatively healthy all my life, probably in credit to you and Mom, so thank you. So this might be something I don't know, but are there other illnesses where you lose your taste buds like Corona?
Not that I know of.
So where does
this is almost this hallmark, sign and symptom that shows up with COVID that I'm not really aware of with any other disease. Think about, my time, working on the helicopter, right? And you think about aviation and how safe aviation is. And it's an inherently dangerous activity, right? And if you think about nuclear-powered submarines, nuclear-powered aircraft, any of these things where you need a high reliability organization. You think about where people are doing something dangerous but have really good performance records. And I think about my time on the helicopter, and you didn't have one person responsible for safety. You didn't have one person responsible for watching for other aircraft. You had everyone on that aircraft with their eyes out. You had everyone on that aircraft empowered to speak up. You had multiple layers of safety around you. We did, everything that we started our morning with a briefing on safety. You had multiple layers of protection while you were doing something. And when I think about COVID, I think about it's not going to be just a mask. It's not just a vaccine. We need layers of defense. We need every possible tool at our disposal being used to keep us safe, to keep our economy rolling, and to keep us moving forward, and to make sure that we are ready to respond to everything else that's going on in the world around us.
So what I take from that is, for the people who are, the anti-maskers, or they don't think it's real or whatnot, what you just said basically is the mask is not there to block or stop it completely. It's a layer of protection.
It's one layer of defense.
Okay,
I'm a gun guy, right?
You are.
And I think about a fire extinguisher, I think about a gun, I think about a mask, all in the same way. And I think that, a mask is probably far more likely to have protective value for me than a firearm is, than a fire extinguisher is. I want all of them, right? I want layers of defense around me. And so when you think about it that way, and a lot of the people that are, against masks, they're conservative, right? They're probably going, and I'm talking in generalizations here, they're probably going to be pro-Second Amendment. They're going to be, in favor of firearms. And I think about that's just another way, that we protect ourselves, that we protect our families and those that we care about. And so when you think about it like that, it's just another layer of defense around you is all it is.
It's a good way to
a lot cheaper.
Yeah. Right. I think probably my last question, and I just now thought of it. There are medical professionals who are, they speak out anti-mask or just anti-anything, they're just going with the flow, let's get life back to normal. So there's some of these people are doctors. Is this for their own agenda? Do you think that is there any type of thing that you see medically that would make sense for that? Or these,
I like to assume the best of people, right?
I know you do.
And I like to think that, they feel that way because, based on their experience, based on their education, they have, a different view of it. And, also with this, we haven't been dealing with this for very long. There's a lot we don't know. The evidence changes. If I think about when I first started working in healthcare, tourniquets were just this thing that nobody did. You were preached to, that you don't do tourniquets, right? Tourniquets are bad.
Really?
Now, everything that we learn is tourniquets are lifesavers. Everybody carries a tourniquet. If you're, any kind of first responder, if you, have a firearm, if you're a security officer, tourniquets are everywhere because we know that tourniquets save lives. But 20 years ago, we didn't think that. And so that's another example where the evidence has changed. Our knowledge has evolved. Thanks to the global war on terror, we know a lot about stopping hemorrhage and saving lives. And we know that tourniquets help with that.
Yeah, I think I told that to a lot of people who would ever ask, or, just in discussion, that, you know, you like you said, started early January. You were kind of put that bug in our ear, and then, you know, you told us to get the was it the pulse oximeter?
Pulse oximeter, yeah.
What else did we get? You told me to,
Well, it was also, you know, get some vitamin D.
yeah, exactly.
And I think that's another thing we talked about health. And I think, you know, like this summer, I made a point to try and get out and get as much sunlight as I could, you know, to go for a run, you know, and get that sunlight, you know, so your body's making that vitamin D, because, you know, there's a, you know, I don't want to sound like I'm too granola, too crunchy, but there's, you know, a lot of reason to believe that vitamin D has some protective value, you know, and not just against COVID. Vitamin D is a good thing, you know, anytime. And so I think there's some things like, you know, keeping a healthy weight, staying active, getting some sunlight, getting some exercise that help protect you, and not just from COVID, but from a lot of different things.
Yeah, I thought it was nice whenever. You know, you kept us updated quite a bit, but like you said, everything changed. You know, when you would text us, it was almost like something weekly was different. Like, you know, this was a little extreme and it's not as dangerous, or you know, this is a new thing that we're learning. And I guess it's just, I think it's important for people to realize that even the professional, it's something new, and people, you know, like you've admitted several times, you're like, you know, it's only been around a year. We're still learning every day, and it changes all the time. So based on data and studies and reports and all kinds of stuff. So,
you know, you have these flawed studies from the late 90s that have been proven to be fraudulent by this guy named Dr. Wakefield, who published some studies about vaccines that turned out to be complete BS. But people still hold on to that, you know, and I think that, you know, again, it goes back to this, you know, distrust of authority that is uniquely American.
I think I'm good, but I got one last question.
Okay.
And it's not COVID, and I forgot about it. I was supposed to ask it at the beginning. I guess it didn't matter, but what are your current pump up songs?
So I listened to some Post Malone. I listened to some Frank Sinatra. And one of the songs that I like to listen to is Rockstar by DaBaby. That's one of the songs that for some reason kind of gets me going right now.
No, that's a good one. That's a big popular one. Yeah, I read that on a blog that was said, anybody you talk to, he said, ask them their pump up songs, and then he said, and then download them, and then be like, you'll think about this guy and vice versa. So Rockstar, Post Malone, and Frank Sinatra.
Yeah.
Man, we covered a lot. It was good. Very good educational stuff, and I hope people listen to it and get some insight, because, I mean, you know, you explain things well, you break it down in layman's terms, you know, you simplify it, and, you know, hopefully people can take some of your advice to heart and consideration, considering, you know, you've been at it a long time, and like you said, you know, you're typically, you know, Second Amendment guy, conservative guy, but you're looking out for the best interests of everyone around you, and you have got no agenda but to keep people healthy. So I'm good, unless you got anything else you want to drop.
I don't. I'm happy, you know, if you get some follow-up questions, I'm happy to try to answer those for you. And, you know, just remember that this is constantly evolving. We're constantly learning more, and I'll definitely try to pass that on to you.
Yeah, I do want to say one last thing. I think everything you've preached here is pretty much what you've told me since I was 7 years old. So it's nothing new, except maybe put on this mask and then distance away from people. Other than that, it's, you know, eat your vegetables, exercise, drink water, don't drink pop.
It turns out that, like, you know, staying hydrated, getting good sleep, getting some exercise, and, you know, staying generally healthy is just a great approach anytime.
Right. Best thing you can do. Awesome. Well, Dad, Brian, thank you very much. It's been fun. That's it.
Thank you. I've always wanted to, you know, do a podcast with you, and I appreciate the chance to maybe try to help some people understand what's going on.
You did great.
Thank you.